Welcome back to TMZ Live. Every time a celebrity gets engaged,
oh my God, I showed my hand.
You know what happens? Put your hand up there. They send out the photos. Oh, look at my ring. And of course, in doing so, of course, they're really showing their hands as well, which has made some people very self-conscious. So we know that celebrities do everything to, like, you know, make sure their faces look perfect until they're 80, 90 years old. Doesn't matter. Well, now the new thing is getting your hands done as well, because you got to be looking good if you're going to be posting photos of rings.
You have to basically do plastic surgery on your entire body now.
Yeah. Well, it's yeah, exactly.
I'm obsessed with this idea, guys. Oh my God. Ryan
hang on, Anna. Hang on 1 second. We'll get to your hands.
Anna, honestly, before we...
Because this is actually a big thing now.
Show me your hands, Anna. Show me your hands.
I have the ugliest hands ever. Every single guy who ever wanted to, like, marry me said, ew.
Wait,
they
what did
did
you just
not say
Wait,
ooh.
What did you just say? Every single guy who wanted to marry me?
Yeah.
Oh,
she had a lot of male callers, I'm sure.
Gentlemen callers.
But anyway.
Listen, it is actually a big thing. I started in England, and you know it's coming here. I'm sure it's being done already.
So Dr. Linder, a big Beverly Hills plastic surgeon who does lots of Botox and knows a thing or two about this, joins us right now. Doctor, welcome.
How are you guys? Good to see you both.
Good to see you.
We're excellent.
What do you think of this, getting this hand job thing?
A hand job. I think that this is just a new trend, and it's an interesting trend to say the least. The good news is it's Juvederm that's being used, and Juvederm is, in 6 months, thankfully, will be gone. So we want to, if they're going to do this type of procedure, we don't want it to be permanent, because yes, it's completely ridiculous in its lunacy.
However, if someone came in, all right, so you're saying it's ridiculous and it is lunacy, but if someone came in and they wanted it done and it can be done safely, would you do it?
You know what, I personally would not do this procedure. As a board-certified plastic and reconstructive surgeon, I have, you know, truly an ethical responsibility to do surgeries and procedures that I feel are reasonable and are useful for my patients.
But Dr. Linder, how is this any different from getting fillers in your forehead or in lines around your eyes? It's the same thing, isn't it?
It isn't the same thing. Specifically, you know, fillers in the face or for reducing wrinkles or for adding volume to the face. That's one thing. Also, there are complications that can occur even with these minimally invasive procedures. You can get emboli. You know what an emboli is? It's when a small amount of material, it can be fat, it can be Juvederm, it can be anything, can get into a digital vessel in the finger. You can end up with an amputation of a finger.
So you're saying doing this in your hand is more dangerous than putting stuff in your face?
Yeah, I do. I believe that. There are very small digital arteries in the finger, and if not done by a properly trained board-certified plastic surgeon, you could end up with loss of arterial blood supply.
But doctor, my understanding is, and I've never had anything like this, but if you had, like, your eyelids are pretty thin, the skin around your eyes, isn't that about as thin as your hand?
Harvey, you're absolutely right. You can get into trouble with blood supply anywhere in the face or the body with any injectable. However, the fingers and the tips are very, very, you know, tenuous, and there's not a lot of room for air. That's all I'm saying.
So, Dr. Linder, what would you say to someone like Anna, who is...
But, Dr. Linder, my fingers are way more wrinkly than my face. So this, and with Instagram in this day and age, when I get engaged, I could never post a picture of my hands on my Instagram.
Please,
so what do I do?
Totally would, Anna.
Oh, my God.
Well, I would hope that your friends, you know, would love you for who you are. I don't care about your finger.
No, the answer is simple, doctor. She's got to buy a glove. Right?
Buy a glove.
Ooh.
Hey, can I, you know what, doctor? I mean, I can't let you go without asking this, because it's like, I don't get it. I mean, it just seems like, just generally, and I'm not trying to, like, go after you on this thing, because I just have a conceptual issue with getting Botox and whatnot. I know why people do it. But when you go down the road, doesn't it almost necessarily become an addiction where you do more and more and more, and so many times it ends up not ultimately looking good?
Harvey, I have patients that come in every week that want things done. And I don't do these operations. I have to have I'm a Jewish guy with a good conscience, like you. And so I can't just operate on everything.
Oh, stop it, Joel. He just took issue with it.
You can't operate on every single patient that has ridiculous desires and things. You know, but listen, I do a lot of body sculpting in my practice, a lot of breasts, a lot of tummies, a lot of liposculpture. These patients need to have these things done. It will help their self-image, and it truly will make them look and feel better. It's worth doing it.
Fair enough. Fair enough. Hey, listen, thanks so much. Dr. Linder, thank you.
It was a pleasure seeing you guys. Take good care.
Thanks again. Okay.
When we come back, I was kidding, but
No, you weren't.